Yeah. All right. Okay. Okay. All right. Oops. Wait. Move that here and start the timer now. All right. Walk in, perform hand hygiene, provide privacy, introduce myself. Hi, I'm Nate. I'm a student nurse. I'm gonna do a full head-to-toe assessment. Can I get your name and date of birth?
Isaiah Budd, 11/28/2004.
Okay, perfect. And first, we're gonna start with the CV assessment. So first, what I'm gonna have you do is look over here. All right, and then could you look to the other side for me? All right, cool. So carotid arteries are symmetric with no bulging. Next, what we're gonna do is we're gonna become auscultations for any aortic bruise noted, or carotid bruise noted, or oops. So what I'm gonna ask you to do is hold your breath for me, please.
Okay.
When I place it down, I'll use the belt of my stethoscope. All right, hold your breath, breathe in. Okay, you can breathe out. And then we're gonna do the other side, right? Breathe in and hold your breath. Okay. And I would do the same motion on the other side of the neck. Upon auscultation of the carotid arteries, no carotid bruise were noted. Next one I'm gonna do is palpation. Okay. All right, can you face me by the way, real quick? Yep. So we're gonna get a pulse right here. And then we're gonna get a pulse right here also. Upon palpation of carotid arteries, heartbeat was regular, +2 bilaterally. Next, what we're gonna do is palpate the precordium. If you could lift up your shirt for me, please.
Just lift it up.
Yeah. All right, cool. So we're gonna palpate with 4 fingers, making sure to go to the mitral valve over here. All right. No pain or tenderness?
Mm-mm.
Upon palpation of the precordium, no pain, tenderness, or pulsations were felt upon palpation. Next, what we're gonna do is listen to the chest using the bell and diaphragm. So obviously we'd start, yeah, you can take off your shirt if you want, make it easier for you. So second intercostal to the right is aortic, second intercostal to the left is pulmonic, third intercostal to the left is Erb's point, fourth intercostal to the left is tricuspid, and the fifth intercostal kind of midline is the mitral valve. So we're gonna begin auscultation using the diaphragm first. All right. Okay, then we'll do the same with the valve. Okay, there we go. Okay, cool. Upon auscultation of the chest, heartbeat was regular, regular +2, regular +2. S2 is greater than S1 at the base. S1 was greater than S2 at the apex. No extra heart sounds or murmurs were heard. Next, what I'll do is I would listen to the mitral valve for 1 minute straight for the apical pulse. If you could turn towards the camera for me. I'm just going to show mitral valve would be in this location right here. I would note any S through S4 sounds, and I'll grade them based on pitch, pattern, posture, quality, radiation, location. All right, cool. Next, what we're going to do is we're going to do the PV system. So first what I'm going to do is inspect your skin. Can you do this for me? All right, cool. And can I see your fingers real quick? Just going to do capillary refill. All right, perfect. And I'll do capillary refill on your bottom feet too. Hold up, let me just show real quick. Okay. Upon inspection of the patient's skin, it is pink, clean, intact, dry, with no edemas, no clubbing, and capillary refill was less than 2 seconds bilaterally. Let me just make sure, hold up. Patient was pink, was appropriate for ethnicity, clean, No edemas or clubbing noted. No pain or tenderness felt upon palpation either.
Nope.
Okay, cool. Now I'm gonna do this real quick. Can you hold out your hands like this? We're gonna measure his radial pulse. Radial pulse. Okay. And then we're gonna do brachial pulse. All right. Patient for the brachial and radial pulse is regular +2 bilaterally. Next, what we're gonna do is inspection of the legs. So if you could scooch over here on this position. All right. Upon inspection of the legs are symmetric with even hair distribution. No varicosities, discoloration, or ulcers are noted. I'll begin palpation of the legs. Let me know if you feel any pain or tenderness.
Nope.
Nope. Okay. Patient has no masses, nodules, or any tenderness or pain noted. Capillary refill for the lower extremities, tested before, was less than 2 seconds. Next, what I will do is I will begin. Can you please lay in the bed for me?
Yeah.
All right. So normally we do the femoral pulse. Femoral pulse would be in the triangle area around the groin. That would be +2 bilaterally and regular. First, what we're gonna do is the popliteal. Can you please move your ankles up? All right, cool. And they would be right under here. Hold up. Let me show you real quick. So it would be right under here, and obviously I'll hold them at the same time. Okay, and around here also, feel pulse. And those would be, popliteal pulse would be +2 regular bilaterally. Next, what we're gonna do is, oh yeah, by the way, also, make sure there's no edemas in the lower extremities, in the malar area, in the shins, in the pretibial areas, and the ankles right here. Okay, also, so then we'll start with the pretibial or posterior tibial pulse. So it would be, let me grab this real quick. It'd go under right here. Oops, hard to see. So we'd hold the pulse right here and do the same one at the same time. All right. And those would be +2 bilaterally regular. And then what we do is dorsalis pedis. So if you can move your feet slightly towards here for me, please. What I do is please raise your big toe. And that indicates and allows me to feel the pulse for the dorsalis pedis. And I'll listen to that bilaterally. It would be +2 regular. Okay. Next, what I'll do is respiration. So you can please stand up.
Stand up.
Or not stand, sit down. Sit up. My bad. First, for respirations, I look at the patient. I'll rate his breathing rhythm efforts. Listen for 30 seconds times by 2. Patient's breathing is even unlabored. Then what I do is look at his face. Facial features are symmetric, no drooping noted. I'm gonna test his level of consciousness. What's your name?
Isaiah
Do you know where you are right now?
Johnson.
What day is it? Oh, how about what month?
April.
And what season?
Spring.
Okay. Patient's learning conscious times 4. And on the tips of nose and lips, there's no cyanosis present. Next, what I would do is I'll check his patency of his snares. First, I'll begin palpation of your nose. Okay, let me know if you feel any pain or tenderness. Anything? Patient feels no pain or tenderness upon palpation of the nose. Then I'm gonna let you plug one nose and breathe in and out for me. And the other one. Patient's nares bilaterally are clear and patent. Next, what I would do is I would inspect the chest. Chest has, first off, oh, can you move this way for me, please? Thank you. Just kind of angle. Patient's chest or coastal angle is less than 90 degrees. Patient's AP to transverse diameter is a 1:2 ratio. Patient's thorax or chest is elliptical and symmetric. And patient is not tripoding and is staying upright. Next, what I'll do is palpation of the chest. So let me know if you feel any pain or tenderness.
Okay.
Any pain or tenderness?
Nope.
Okay, I'm gonna do the back for you, please. If you could turn this way. Okay. And I'm gonna put my hands over here. Breathe in and out. Okay, cool. All right. So patient's chest anteriorly and posteriorly has no masses, nodules, and no tenderness, and chest wall is stable. Next, what I'm gonna do is begin auscultation of the chest or for the lungs. So I'll begin anterior and I'll use my diaphragm. So breathe in and out whenever I put pressure on your chest. Okay. Okay. And okay. Other side, right? Okay. Okay, then I would say upon auscultation of the anterior chest, it was cleared auscultation all lobes bilaterally. Now we're going to ask you to turn this way for me. Thank you. And same process. Okay. Okay. All right, you can turn back normally. So, also, I will note, if I didn't do this correctly, you would start from one side and move to the opposite and then go down and follow that pattern. Also, for posterior auscultation, it was cleared auscultation for the lungs, all lobes bilaterally. Next, what I'm gonna do is I'm gonna explain, or I'm gonna do CVA tenders. So if you face that way again, apologies. What I'm gonna do is I'm gonna get one of my hands and I'm gonna ulnar facing of my fist and I'm gonna place down. Let me know if you feel any pain or tenderness. No, nothing. And then I'm gonna do the other hand with my other hand. Anything? Okay. Oh wait, sorry, my bad. It's second intercostal, so it'll be right here. We'll do that again. Nothing.
Nope.
And this one. Yeah, sorry. Oops. Anything?
Nope.
All right, no pain or tenderness, which fell upon CVA tenderness test. Then I would explain the difference between sounds respiratory-wise. There's fine and coarse crackles. Fine crackles are high-pitched squeezing noise, or crackling noise, and wheezing is a high-pitched like musical squeezing noise. Okay. And next, what I would do is I'll begin the abdomen assessment. So, if you want to lay down first. All right, I'll just bring this here. Okay, so first I'll inspect the patient's chest or patient's stomach. Abdomen is flat and symmetric with no hernias, discolorations, and discolorations or inflammation or masses or nodules. Skin is even in color and intact. And umbilicus is inverted and midline. Next, what I would do is auscultate for the aortic bruits. So I'm gonna bring it over here again. So clear view. So I'm gonna listen to aortic bruits real quick. So I would do it 2 inches above the stomach line. Switch over, and I'll use the bell of my diaphragm. On auscultation of the abdomen, no aortic bruits were present. Next, I'm going to do auscultation of the bowel sounds. I have to listen to 5 minutes that say it's absent. I'll start in the right lower quadrant and move clockwise. Upon auscultation of the bowels or the abdomen, all bowel sounds were normal active across all 4 quadrants. Next, what I'll do is I'll do palpation. I'll do my fingertips and I'll do in a circular motion starting at the right lower quadrant. Let me know if you feel any pain or tenderness.
Okay.
Okay. Going clockwise. Any pain or tenderness felt? No pain or tenderness was felt upon palpation of the abdomen. Next, what I'll do is I'll explain that deep palpation is an advanced care provider skill, so normal nurses would not be able to normally do that. And then what I'll do is abdomen. I did the palpation, explain thing. Let me make sure. Okay, so inspection, auscultation, palpation, that. Okay, cool. I think we will just move on from that then. Next we'll do, you can put your shirt back on, we're all good. What I'll do next is I will do the lips, throat, and tongue, mouth assessment. Because respiratory, CV, yeah, okay. So, starting off, facial features are symmetric. Nose is midline, symmetric with no lesions, inflammation, or bleeding present. I'm going to palpate the frontal and maxillary sinuses. Let me know if you feel any pain or tenderness.
Nope.
Nope. Our patient feels no pain or tenderness upon palpation of the frontal and maxillary sinuses. Next, what I will do is I will inspect the lips. Lips appear dry, or moist, pink, not dry, with no bleeding or cracking. Next, I'll examine the mouth. Could you open your mouth for me and say ah? Alright, perfect. I don't know if you need to see this or not, so just say ah. Perfect. And can you lift your tongue up for me? Alright, perfect. So, patient's uvula is midline, rises with formation. Patient's pharynx is pink, moist with no enema or exudate, and the tonsils, you have your tonsils removed?
No.
Are pink and grade 1. Next, we're going to say the buccal mucosa and the floor of the mouth are pink, moist, even, midline, with no lesions, masses, nodules, abnormal growths, inflammation, bleeding, discoloration noted. And the tongue is pink, even, midline, pharynx. Because I said pharynx, buccal mucosa, tongue, floor of mouth, pharynx, uvula, tonsils. Yep. Okay. Cool. Now, can you please smile for me? All right. And can you lift your gums lower and upper? Thank you. All right. Patient's teeth are white and smooth. Gums have defined border. No bleeding or discoloration in the gums. No dental caries present, and the gums adhere to the teeth. I believe, honestly, that's it, right? Yeah, because frontal, nose, time. Tops are the inspect face, nose, then I did face, nose, maxillary, frontal sinuses, lips, throat, buccal mucosa, teeth. Yeah, fine. Okay, next what we're going to do is we're going to start with the eye and ear assessment. So first, I'll test the patient's Snellen and Rosenbaum charts. For the Snellen chart, it would test distal visual acuity. Patient scores a 20/20 out of 20 vision without the use of corrective lenses. Cranial nerve number 2 is tested and intact. Next, what I'm going to do is do the Rosenbaum test to test near visual acuity without physical acuity. Patient scores 20 out of 20 vision while looking 14 inches away from a newspaper. Cranial nerve number 2 is tested and intact. Next, what I'm going to do is do the 6 cardinal gazes of view. Can you please look at this for me? Okay. Patient's 6 cardinal gazes of view are tested and intact. With no nystagmus present. Patient's cranial nerves 3, 4, and 6 are tested and also intact. Next one I'm going to do is inspect the eyes. Can you please do this for me? Conjunctiva is pink and clear. Cornea, you're good, by the way, sorry. Cornea is smooth and clear. Sclera is white. Iris is blue with even coloration. Pupils are black. Upper and lower eyelids have no redness, edema, and are intact, or edema and are intact. And eyebrows are brown, evenly distributed and symmetric. Next, what I'll do is I will do palpation of the lacrimal apparatus. So let me get gloves real quick. Perfect. All right, cool. Next, what I'll do is palpate the lacrimal apparatus. Go around here, bony orbit, upper and lower eyelids, and kind of like eyebrows. Any pain or tenderness felt? All right, you always ask before for everything. Patient has no tenderness and no discharge in the lacrimal apparatus. The upper and lower eyelids are intact with no edemas, tenderness, or swelling. And the upper and lower eye, or the eyebrows and bony orbit have no swelling present. Next, what I would do is I would inspect I'll do Perla. So I'm gonna look at my pen light and look at the wall and look back. Next, what I'm gonna do is inspect your pupil size. Okay. Okay. All right. And then I'm gonna shine light back and forth. Cool. Patient's Perla bilaterally is equal, round, light directly and consensually, and can accommodate. Cranial nerve number 3 is tested and intact. Next, what I'll do is I will inspect the ears. Head of ears are equal to eye level. They are equal, or the top of ears are equal to the eyes. Ears are pink, which is appropriate for ethnicity. I'm gonna look at the lesions. Only one lesion is present. Can you turn the other way for me, please? Only one lesion is present in each ear, and there's no redness, foreign bodies, or drainage present or exudate in the ears. Next, what I'm gonna do is palpate the tragus, external ear, and mastoid process. Let me know if you feel any pain or tenderness. Yeah, no pain or tenderness, or no pain or tenderness is felt upon palpation of the ear. Next, I'm gonna do auditory function. So I'm gonna close your eyes, and I'm gonna rub my fingers. Let me know if you can hear it, and raise your hand where you can hear it. All right. Okay. Okay. Patient's auditory function is tested intact. Cranial nerve number 8 is tested and intact. Next, what I will do is I will start inspecting I'll start inspecting the fingers. Capillary refill is less than 1 second. Turgor is brisk. Less than 1 second, or capillary refill is less than 2 seconds. Next, what I'll do is I'll look at the napes of the neck for parasites and behind the ears. When parasites are noted, I'll look at the hair and palpate it a tiny bit. Hair is straight, thick, or curly, thick, evenly distributed, and brown with no signs of parasites noted. Nails are, can you do this for me? Nails are, contour is, you're good, are curved, normal, pink, with no clubbing present. Yeah, and also I would mention the eyelashes are curved outwards and are evenly distributed. Next, what I would do is I look at the skin. All right, skin is clean, dry, intact, and pink, which is appropriate for ethnicity, bilaterally, upper and lower extremities, and upon palpation. Could you raise your shoulders for me? All right, and could you lift your legs for me? All right, cool. Upon palpation, a patient has no increased temp, masses, nodules, crepatitis, tenderness stated. No tenderness, no pain?
Nope.
Okay. Next, what I'll do is I'll look at the lesions. I'll just use this one right here. Go here real quick. Our patient's, I'll do A, B, C, D, E. So patient's lesion is symmetric with a defined border. Color is brown, diameter less than that of a pencil eraser head with no evolution, exudate, elevation, and it hasn't changed in a while, has it?
No.
No evolution either. Okay. Next, what I would do is I'll just do the muscle assessment test. So first, I'll do the hips and shoulders. Could you raise your shirt for me, kind of like that? All right. So shoulders are symmetric with no swelling deformities. Upon palpation, no masses, nodules, no pain or tenderness, no crepatitis, increased temp, inflammation, bleeding were noted. Now I'm going to do the strength test. So if you could for me, please lift it like here. That's flexion. Then go back down and kind of stretch outwards. That's extension. Go this way, abduction, down, adduction, and then kind of a circle motion, and then backwards. That's circumduction. And then I'm going to ask you to raise your shoulders for me. All right, perfect. Patient has a full active range of motion for the shoulders bilaterally, and patient has +5 strength for the shoulders bilaterally. Next, what we're going to do is we're going to do the hip assessment, or the hips. So if you could lay down for me. All right, cool. What I'm going to do next is I'm going to inspect the hips. Hips appear symmetric with no swelling or deformities. Also, I would inspect the neck before anything too, to know any lumping, scarring, and to make sure it's symmetric. Upon palpation, any pain or tenderness? Patient has no masses, nodules, increased temp, crepatitis. Yep, lift your legs. Okay, no crepatitis or increased temp, bleeding, or inflammation noted. Next, I'm going to do the strength test. So if you could for me, stick your leg out like this and back, and do it for the other leg. This hip abduction, adduction. Now what I'm going to ask you to do is put your knee like up and do a circle motion, and then go the other way, and try using your hips for it. Okay, another one. That's hip circumduction, and I just want you to do it for the other leg as well. All right, perfect. Hip circumduction, and then what I'm going to ask you to do is put your knee up, and I'm going to ask you to move it out inward, and then outward. All right, and then we'll do it for the other one. Inward and outward. This internal and external hip rotation. I would say the hips are regular plus or full active range of motion for the hips bilaterally, and the patient for the hips has +5 strength bilaterally. How much time do I have left? 20, like less than 2 minutes. Let me make sure I got everything good. I did hair, neck, abdomen. Abdomen was inspection, palpation, aortic, bowel, spine, tenderness. I did that too. I think I did CVA tenderness with respirations on accident. Even on labor, fine crackles. I did nails. Yeah, 28 minutes. I'll just, I think I did. Oh wait, also I would confirm any surgical histories prior to muscle assessment test. There we go.
Yeah, no surgeries.
No surgeries, awesome. Make sure the patient is comfortable, everything's all sorted out. Patient's call lights within reach, document my findings, perform hand hygiene, and exit the area and provide privacy.